Aches and pains, illnesses and diseases. These plague us every day. Here on Good Morning Sri Lanka, we care about your health and lifestyle. So, in the studio today, we have Dr. K.D. Daminda, a consultant physician. Good morning to you.
Good morning, Jason.
And this is Good Morning Sri Lanka. I just had to mention that. Alright, how was your drive here? Early in the morning. Alright, so tell me, what are non-communicable illnesses that people... This is not really a technical term.
Yes.
But what is it exactly?
Yeah, non-communicable diseases are the diseases which don't communicate from one person to the other.
Right.
You don't infect the other person. So these are a very big disease burden worldwide today, and especially in Sri Lanka. They include mainly the high blood pressure,
right,
diabetes mellitus, and also some chronic respiratory illnesses like COPD. We call it COPD, right, chronic obstructive pulmonary airway diseases, and also cancers.
Right.
So the burden is so high that they lead to 2/3 of the deaths worldwide.
So let me get this straight. Do regular, I'm saying like coughs or colds, do these fall under the category of that of non-communicable?
They are coming under communicable diseases mainly.
Right.
Cough and cold.
Right.
Infections.
Because this, but when you mention chronic, it's more severe, I'm guessing, when you like a chronic disease.
Certain illnesses are chronic. That doesn't mean that they are severe. Even acute illness can be a severe one, and that can kill a person.
Right.
Chronic illness is a one that can run in your life for a longer period of time, and they can also kill a person very slowly.
Right.
And that reduces the quality of life as well.
Can these be put under the category? Is it transferable to another person? Any of these transferred to another person? So, by the touch?
If it is a communicable illness like infection, say for example, even simple viral flu or common cold, that can infect one person to the other. And on the other hand, diseases like tuberculosis, which can run a chronic course,
right,
and that also can infect another person.
Now tell me the difference between, not difference actually, the difference between a virus and an infection.
Yeah, infection is organism associated illness.
Right.
It may be a virus or a bacteria or fungus or a protozoa or a amoeba or whatever.
Right.
So there are so many causes of infectious diseases.
Right.
But viruses are very common, and most of the time we get viruses than other illnesses. The good thing about virus is that it gives rise to a natural cure.
Right.
Unless it gives rise to complications, in which case you have to get the patient to the hospital and look for the complications and prevent them.
Right.
And then it gives rise to a natural cure. But on the other hand, bacteria, you have to detect them early and treat them early, because we have antibiotics for the bacteria.
Right.
Otherwise that can kill the person.
Okay. Coughs and colds, now these are very common in everyday life of any person living in Sri Lanka or anywhere around the world. What does cough and cold come under? Does it come off as virus? Does it come off as an infection? Or because you can get a cough and cold anywhere. So how does that fall under a category?
Yeah, it comes under virus, and there are so many viruses. Probably thousands of viruses can cause common cold.
Right.
And there are certain other different categories of viruses that can cause we call upper respiratory tract infections.
Right.
So these all are infections that can transmit from one person to the other.
Right.
And probably the upper respiratory tract infections, including cough and cold, the flu, they are making the majority of the infections worldwide.
What is, from your personal experience, when do you see like a person, when they come to that juncture, when they have an illness or a cough or a cold, when do they go and see a doctor?
Yeah, it has been the habit for ordinary people to consult a doctor at the very early phase of the illness, which is not really necessary.
Okay.
So if it is going more than 3-4 days, or if the patient is getting unusual symptoms like shortness of breath and very high fever and chest pains, and if they are producing a lot of phlegm, yellowish color sputum, then probably that may be the time. Even if it is early, day 1 or 2, you can consult your doctor. Otherwise, if it is getting better by 3rd day, 4th day or afterward, you don't have to really see a doctor.
Right. Okay, now here's one thing. tell me your definition of health. What is the definition of health?
Yeah, definition of the health, it has been broadly defined by the World Health Organization.
And other. If you don't mind me, excuse me, I think we have a slideshow of it at the moment, but do go on, please.
Yeah. Health is, by definition, overall mental health, social health, and absence of diseases.
Right.
But it comes under a very broad category, but not merely the absence of usual illnesses.
Right. What are the WHO statistics? What does this mean exactly?
Yeah, WHO statistics shows that, as I at the very beginning told you, these non-communicable diseases are giving rise to the major causes of death worldwide.
Yeah, as it was shown in the screen before. Right.
Yes. Namely, strokes, heart diseases, and respiratory illnesses like chronic obstructive pulmonary disease, which is associated with tobacco smoking, and also cancers. These are the main killers worldwide. To your surprise, they make 2/3 of the deaths worldwide.
Is that so?
Yes.
Wow. All right. Getting back to when you're going to see your doctor, do you think, like you said, it's not really necessary to go at an early stage? Is it okay if you self-medicate over the counter, or if you try some home remedies? And I like myself some home remedies.
Yes. These home remedies had been there from the time the people were there.
Yeah.
So I won't say don't take the home remedies as long as you are confident and it has been going through generations to generations. But this self-medication and over-the-counter medications we don't really recommend. But simple coriander water, warm water, or whatever the porridge or kanji you eat when you are sick, that of course we can say yes. But treating your illness without knowing what it is the dangerous thing to do.
Here's one thing that I have a problem with. Now, I remember this very clearly. When I was a little boy, my mother I would have these fake illnesses. I would just fake it, right? I would have problems with, sleeping and at night, and my mother would say, okay, here's a very special home remedy, which wasn't really a remedy, it was just sugar and water.
Yeah.
So but here's the thing, I felt cured.
Yes.
So could you tell me how that played out?
Yeah,
why I feel cured when it's not really a remedy at all, it's just sugar water?
Yeah, that's right. I mean, even with any medication, we call the placebo effect is there.
Correct.
In your case, in fact, you were not doing the right. you were just faking it, and you were cured.
Yeah.
Not because of the medication she gave, but because of the psychological effects and the care that you required from your mother, the love and whatever you wanted to get, you got it, and you got cured.
That is true, but I wasn't faking it though. It was, when I mean fake, I mean in the sense like it's not a real disease, but I felt it was real.
Okay.
So I felt it was real, but then I felt cured. But again, like you said, the placebo effect does
placebo effect and the psychological benefits are there.
But the placebo effect, again, if you go into that, that's mainly used with a sugar pill. If I am correct, they mainly use a sugar pill.
Not really. Maybe starch. Not the pure refined sugars they use, but mainly dummy tablets.
Right. Yes. So these are all, again, playing into your mind, if I am correct. Your mind controls what the placebo effect is pretty much telling you, is that your mind can control what your body would perceive to be.
In the sense that this placebo effect is not a very, very significant effect.
Right.
It may be helpful in simple illnesses, but when it comes to a serious illness, it's negligible.
Right. So you're saying that it's very advisable that you do not try this, you go to actually see a doctor.
Yes.
Right. Self-medication again. Now, could you tell me, like, a lot of people, some people, like you said, don't go to the doctor at all. They would just medicate themselves at home, and is sometimes to a certain extent that they would be really sick, but they'd be like, no, it's fine.
It's very dangerous, in my opinion, to do that way.
Right.
Because there are so many illnesses which need early treatment. Unless you give the early treatment, that can really lead to complications and end up with death.
So would your mind change on when you should see a doctor? Because earlier before, you told me that it's okay if you go a little
That's the thing. You should understand the basic things about the illnesses
Right.
when to see a doctor. So by experience, you should know, your parents know, everybody know that this is not the right thing to do. This is the stage that we have to see a doctor.
Right.
So if you are feeling very sick, very bad, or if you are feeling unusual, unexpected symptoms, yes, you have to see the doctor.
Right. Okay. Infections. If you are prone to infections, what is the long-term solution to it?
For infections, of course, there are ways and means of preventing that, but when it comes to viruses, it's very difficult to avoid viral infections, which are usually transmitted through upper respiratory tract. It's happening in crowds, in schools, public places, so sometimes it's very difficult for you to avoid such circumstances. But if you follow the basic hygiene, you will be able to avoid them as much as possible,
Right.
Such as using some handkerchiefs when you are sneezing, and if you wash your hands before you take your meals, if you avoid always touching your face or eyes or
Right.
nose or mouth. So this basic hygiene stuff will definitely help you
So
to avoid.